Hello everyone, my name is Dr. Imaadali Fotowatzadeh from MGM Medical College and Hospital, Navi Mumbai. My topic for today is ultrasound artifacts. Ultrasound artifacts represent a false portrayal of image anatomy or image degradations related to false assumptions regarding the propagation and interaction of ultrasound with tissues, as well as malfunctioning or maladjusted equipment. Understanding how artifacts are generated and how they can be recognized is crucial, which places high demands on the knowledge of the sonographer and the interpreting physician. The aim of the study is to understand various artifacts encountered during USG scans. The main objectives include to improve imaging interpretation by identifying and differentiating the artifacts from true pathology, to utilize artifacts as a clue to aid in diagnosis of a particular pathology, to enhance diagnostic accuracy by avoiding misdiagnosis due to artifact misinterpretation, and to ensure optimal patient care by recognizing and correcting artifacts and avoiding further unnecessary diagnostic procedures. The first artifact of the study is acoustic enhancement. Posterior acoustic enhancement refers to the increased echoes deep to structures that transmit sound exceptionally well. The presence of acoustic enhancement aids in identification of cystic masses predominantly. The first image shows a hepatic cyst showing posterior acoustic enhancement, and the second image shows a colloid cyst showing posterior acoustic enhancement. Now we move on to the next artifact, which is acoustic shadowing. Posterior acoustic shadowing is a form of ultrasound artifact characterized by apparent lack of signal deep to an image tissue interface due to all or nearly all of the transmitted sound waves to the transducer or absorbed by the tissue. In this image shows gallstones with posterior acoustic shadowing. Next, we move on to the aliasing artifact. Aliasing is a phenomenon inherent to Doppler modalities which utilize intermittent sampling, in which an insufficient sampling rate results in an inability to record direction and velocity accurately. As we can see in the first image, the common carotid artery is scanned with an inappropriately low PRF, which shows the aliasing artifact. This can be corrected by increasing the PRF. Our next artifact is anisotropy. Anisotropy is an artifact encountered in ultrasound, notably during musculoskeletal ultrasound. In musculoskeletal applications, the artifact may prompt an incorrect diagnosis of tendinosis or tendon tear. This anisotropic effect is dependent on the angle of the insinuating beam. The maximum return occurs when the ultrasound beam is perpendicular to the tendon. As we can see in the first image, anisotropy is seen when the transducer is not perpendicular to the volar wrist, and it can be corrected by keeping the transducer perpendicular to the volar wrist as seen in the second image. Now, the color brew artifact. The color brew or tissue vibration artifact is a type of color Doppler ultrasound artifact which results in color signal overflowing to the perivascular tissue, most often caused by stenosis, AV fistulas, or shunts. Thus, this artifact is useful by pinpointing areas of potentially pathological blood flow. As we can see, this is an image of the radiocephalic fistula of a patient showing the color brew artifact. Next, we have the blooming or the color bleed artifact. Blooming or color bleed artifact occurs when the color signal indicating blood flow extends beyond the true boundaries, spreading into adjacent regions with no actual flow. It is important to be aware of it as it may obscure partial occlusions such as thrombi, resulting in misdiagnosis. It can be avoided by lowering the color gain until the bleed of the signal outside the vessel disappears. The first image shows color Doppler signal extending beyond the anatomical limits of the vessel distal to the transducer due to inappropriately high color gain, which is corrected as seen in the second image by decreasing the color gain. Comet tail artifact. Comet tail artifact is a grayscale ultrasound finding seen when small calcific, crystalline, or highly reflective objects are interrogated and is believed to be a special form of reverberation artifact. This is an image which demonstrates reverberation artifact from the gallbladder wall consistent with the diagnosis of adenomyomatosis. Next, we have the color comet tail and twinkling artifact. The color comet tail typically resembles the grayscale comet tail artifact. It is seen in a situation when a highly reflective object is interrogated with color Doppler. Immediately deep to the object, a tail of linear alias band of color extends away from the probe. The image shows a renal stone showing colored comet tail and twinkling artifact on color Doppler examination. Twinkling artifact. Twinkling artifact occurs as a focus of alternating colors on Doppler signal behind a reflective object such as a calculus or air, which gives the appearance of turbulent blood flow. It appears with or without an associated color comet tail artifact. The image shows a gallstone showing twinkling artifact on color Doppler examination. Electrical interference artifact. Electrical interference artifact is an ultrasound artifact usually caused by the ultrasound machine being too close to the unshielded electrical equipment. The disturbance appears as an arc-like moving bands in the ultrasound image. The mirror image artifact. Mirror image artifact in sonography is seen when there is a highly reflective surface, example the diaphragm, in the path of the primary beam. It is a friendly artifact that allows the sonographer to exclude pleural effusion by the reflection of the liver image through the diaphragm, as we can see in both of the above images. Next, reverberation artifact. Reverberation artifact occurs when an ultrasound beam encounters two strong parallel reflectors. In the above image, the contraceptive device detection is improved by the appearance of a reverberation artifact. Ring down artifact. Ring down artifact is a special type of resonance artifact. Its appearance is similar to the ladder-like reverberation. The artifact is only associated with gas bubbles. In this image, you can see the blue arrows that indicate the ring down artifact. Next, we have the Venetian blind artifact. The Venetian blind appearance is a sonographic finding that is typically associated with adenomyosis but can also occur in uterine fibroids. It is an uncommon tissue cutting artifact that leads to the formation of parallel series of strips of tissue separated by one another by narrow clear spaces. In this image, we can see the Venetian blind artifact in a case of adenomyosis of the uterus. So, through this study, we have discussed how in ultrasonography, artifacts may cause structures to appear in an image that are not present anatomically, or a structure that is present anatomically but may be missing from the image. USG artifacts may also have structures as present but incorrect in location, size, or brightness. USG is prone to numerous imaging artifacts, and these are commonly encountered in our clinical practice. And these artifacts have the potential to interfere with the image interpretation. So, we conclude that ultrasound artifacts are commonly encountered and familiarity is necessary to avoid false diagnosis. In some cases, specific artifacts can even offer valuable diagnostic information. For instance, some artifacts may be indicative of certain pathologies. They are not to be confused with the ultrasound probe defects, which represent hardware failure. Thank you for viewing the presentation.